Okay, so on to health promotion. The concept of health promotion is one about, it is a preventative concept. It is on the basis that if people understand health conditions and health issues, that they are better to respond to them as individuals or collectively in terms of the group. And it's the importance of getting that information out there to empower individuals to make choices about their medication and the way in which they need to be treated. It is not something that can be siloed into one government department. It's not a health issue for the health department. It has to cross departments because it has relevance in transport, employment, education, in terms of letting people understand not only their rights and their responsibilities, but the issues involved in each of the major health concerns of our day. The private sector need, and by private sector I mean those organisations not in state or government hands, so businesses, shops, restaurants, finance, whatever, what have you, and food production and manufacture, as well as other areas. At the moment, there is an incentive for us to purchase healthier food by the taxation on sin foods, the ones that have high sugar or are unhealthy for you in other ways. This needs to be greater, and a reach out to the private sector initiatives, looking at urban renewal, cycle lanes, city farms, environmentally enhancing projects which the private sector would hopefully embrace and like to be involved with. The role of the individual within society is that thing of empowerment. And it's important that those that are on the receiving end of health understand the issues involved in detail, and that they are involved and engaged and empowered. Health professionals' role is to provide the link. They are at a high level of expertise in the profession. When if you at the coal face, as it were, they understand the issues because they face those issues day to day, and they should be the centre and a part of any government activity or any promotion that the government see. It is important to link their expertise with what is produced by government in terms of health promotion. They need to be able to advocate for their patients. The close relationship between the medical professionals and their clients means that they're in a strong position to advocate for those that do not have voices for whatever reason, and that their role is essential in feeding again into the idea of health promotion and the campaign. The other element is the advice health professionals might give. Crucial again, if it's important that they advocate for their patients, and if they can pass on their knowledge and experience of clinical matters up the line, as it were, it's also important that they can provide this experience to the end user in the form of advice on healthy lifestyles and healthy living. It is important not simply because they're in a position of authority in that relationship between patient and carer or patient and health professional, but also because they will know how to mediate the message. I think hectoring has been seen not to work, so their personal relationship, they'll know when to say and when not to say. These are the various parts for the health professional.